guys, it's Mary and Peter from the Fry Life. I have cystic fibrosis, and part of having cystic fibrosis is that my lungs have too much mucus in them. And so part of our everyday job with living with CF is trying to loosen the mucus from my lungs and get it out so that we can cut down on the amount of bacteria in my body and try to help my body breathe a little easier. We are here to show you how we do that with manual chest PT and the different positions that are involved. So you're gonna want something to cough your mucus into. And that is a celebration when it comes out because it's not supposed to be in there. So the best way for me to get it out is using little plastic cups. I have found these to be the best way that I can effectively get it out of me and not think about it. And if I spit it into a tissue, it tends to make me gag, which is not fun. And I don't like spitting it into a clear cup because then you can see it. Anyway, it's the reality of CF. It's disgusting. So get yourself whatever makes you happy. For me, it's these little red cups from the Dollar Tree. All right, so guys, the first step that I usually do when it's time to do chest PT, I put my hair up because when they're doing chest PT on you and they start hitting on your hair, it hurts. So just put your hair up in a ponytail, or if you're a guy, don't.
Oh, if you have long hair, put it up in a ponytail. I
guess so. Okay, so once you have yourself a wonderful person to volunteer to do your chest PT, it's good to have open communication so that if the person isn't doing the PT hard enough, or if it's a little bit too hard for you, you can talk to them and say, hey buddy, that hurts. Or and whatever.
If you're a caretaker, don't take it personally. Like, because Mary knows her body best. And I think that's important. That's one of the reasons that we do chest PT, is that it's able to, Mary knows where we can focus our energy and try to get some of that mucus out.
Also keep in mind, if you're a patient, that you might be more sore, like if you have had a kidney stone or something, down there is gonna be sore, like by your kidney. Or I have liver disease, so sometimes my liver is a little bit more sore. So it just means that you have to tell your PT partner, hey, can you move up an inch or down an inch or go a little lighter on this position? So you'll figure it out and see what works best for you. We've been doing this, I guess, ever since we got married.
Yeah.
So
5 years.
Yeah.
And I'll just say, like, I'm not in the medical field. I don't have any like training in this. Mary just has taught me, and I've learned from physical therapists and respiratory therapists over the years. But it's something that basically anybody can learn to do. It's just a matter of really just helping Mary's body get out the mucus. So as you get started to do chest PT, sometimes if you have larger rings, it's good to take those off just so that the rings don't hit her when we're doing PT.
One of the things that I think is really important is to keep the caretaker in mind when you're getting ready to do PT. If possible, lay on something high enough or low enough that it won't hurt their back. Because a lot of times, I mean, he is so good to do PT wherever we are. If I'm down on the floor, he'll bend down and do it. But it's good, like right now I'm on kind of a tall bed, so when he's standing, he doesn't have to hunch over a whole lot to be able to reach me. So keep the caretaker's back in mind.
Yeah, and for those of you who are physical and respiratory therapists, thank you for what you do. I get exhausted after one session of this, and some of you guys do this all day long. So props to you guys.
And just so you know, what you do does make a difference.
Yeah. I think Mary it'd be fair to say that chest PT is is probably one of the most effective therapies for Mary feeling more clear and open.
For sure. I mean, I do other types of chest clearance, like airway clearance every day, and I value those types of airway clearance, but this is by far the most effective for my lungs.
And we'll also say that we don't do this every day. There are times when Mary's infection is worse where we try to do it more frequently. Chest PT is something that we use to supplement her normal airway clearance.
So when I'm more sick, we try to do it once to twice a day in addition to the vest airway clearance that I already do. And then when I'm in the hospital, we do chest PT 3 times a day, and then I do my vest an additional 1 time. So it's really a matter of talking to your care team and finding out what will work best for your lungs and how much airway clearance would be appropriate to keep your lungs as clear as possible.
And it's really not a formula. It is kind of a lifelong journey. I call it a journey of keeping your lungs clear and whatever it takes to do that. So,
and figuring out what works best for your lungs.
We're gonna show you what works best for Mary, and hopefully it can help you out some way.
Here we go.
So the first position is to reach the upper lobes, and we're gonna start on her shoulder area, shoulder and kind of toward behind her shoulders on her back. And so the technique for doing chest PT is really quite simple. It's a matter of cupping your hands. We're going to be basically pounding on Mary's back for this entire session, and it's a matter of, the technique is really just figuring out how to cup your hands so that you aren't slapping, and rather you want some air to be in there in the kind of palm of your hand. So what I do is I take my hands straight and then I bend my fingers in, and I do it until I can kind of make a cup with my thumb, like this. And then you can feel the difference between a slap and a cup. And
so can I.
And so Mary's the best judge, but as a caretaker and someone learning to do this, kind of start out by doing some pounding and asking what feels most effective. Because really, when you cup the hand like that, where there's air and it's not a straight-on slap, she's not gonna feel the sting, but she'll feel the pressure that it puts on her lungs. So I alternate each hand, and often Mary will tell me, go harder, go lighter.
It's fine. And the patient, if you're in the hospital, your PT person will be keeping track of the time. But at home, we just use my cell phone and put on a 3-minute alarm. So we do this position for 3 minutes and then move on to the next.
So as you do it, you'll kind of find a rhythm. And it's important to find a rhythm, otherwise you're gonna be like, and if you find a rhythm, you can kind of keep doing it without really thinking about it too much.
So once you've reached your 3 minutes, at the end of that, you will do 5 breaths, and when you inhale, hold it for a couple seconds and then exhale slowly. And during the exhale, the person will do vibrations on your lungs, and here's what it looks like.
So take your hands firm and steady straight on the upper lobes here on her shoulders, and she is going to inhale and then exhale. And as she's exhaling, I'm going to just do firm and steady vibrations on her shoulders. And what this does is, the chest PT has worked to break free some of that mucus, and as she breathes in and exhales, some of that mucus is able to be coughed up.
Make its way out.
Yep.
So you'll do that for 5 breaths. And sometimes you'll find that you are coughing more than others, and that's fine, and kind of just gauge yourself. Don't overdo it, because sometimes the coughing isn't productive. So I'm just saying, like, know your body and know your cough and figure out, like, sometimes I'll start coughing really hard on the first vibration and my lungs are kind of super exhausted by the end of that first cough and I just need to move on to the next position because this is just the first of 9 positions.
The second position, you're gonna move down the back a little bit and still work on those upper lobes. And so it's really kind of behind the shoulder blades, the upper back area. So you're gonna do the same thing, cup those hands and get pounding.
So you can do 3 to 5 minutes or whatever works best for you per position. We've been doing 3 minutes. We found that that's a good amount of time. And yeah, it is kind of a time-consuming event to do chest PT. So it's always good to have some entertainment. We love watching YouTube while we do chest PT, or
we'll put a show on Netflix.
Yeah.
We have some friends who, I think they read, the wife reads while they do chest PT. She reads out loud and they work through novels. And so there's different ways to kind of fill the time while you're doing this.
After your 3 minutes are up, do your 5 breaths in and vibrations. The next few positions are laying down. You can do these in different orders. This is the order that we've done and it works best for us.
So we're gonna start on her upper right side, cup the hands, and 3 to 5 minutes.
And you can put a pillow in between your legs if that's more comfortable for you. And yeah, it's just a matter of like figuring out how it's most tolerable.
Yep. All right, once you're done the 3 to 5 minutes, do your vibes. And as you're learning to do this cupping technique, it might be helpful to notice the difference on your own hands. If you clap them together, it kind of makes that smack, and then practice cupping and it makes more of a hollow sound.
That's pretty good. I tend to try to kind of control my cough during the vibrations. My body wants to cough right away, but I've noticed that if I try to hold my cough in for the vibrations at the very end, then all the mucus is loosened and ready to come out. If I cough on all the vibrations, I do get mucus up, but it's more effective if I kind of focus on controlling it and letting the vibrations do their work, and then at the end I let my body cough really hard and it gets mucus out. So it's something to try.
For the next position, Mary's gonna lie on her back and we're gonna target those upper lobes again. They're on her chest. Now for those of you who have a port, you have to kind of for the caregiver know where that port is, and what I find is if I cup my hands, and every port is different, but I can kind of cup my hand around the port to just kind of go right over top of it. But again, some people can tolerate this position, others can't. Do whatever works for you. And after 3 to 5 minutes, do the vibes.
Count.
Now Mary's gonna turn on her so I can get to her left side, and we're gonna do the upper lobes on this side. Okay, after 3 to 5 minutes, do your vibes.
Alright, so at this point in the process, we move on to positioning called Trendelenburg positioning. And basically that's a fancy way of saying tilting your head down and your body up. So basically we're going to do upside down PT. I find this to be a very effective tool in getting the mucus out. When you're in the hospital, they can tilt your hospital bed, and it's a very easy way to do it. At home it gets a little bit trickier, but we are going to show you a special way to do it with a couch cushion. Time to get creative with the Fry Life.
So,
hi Oliver.
Did you want to come join us for Trendelenburg? Hey buddy.
This is Oliver.
Alright, so we're gonna take 2 pillows. Use as many pillows as you need, but we're going to take a couple pillows and a couch cushion and prop up the couch cushion so that you get a downward angle as Mary lies on this. She's gonna put another pillow right here for her head and another one. Make it so that it is comfortable and doable.
Okay, here we go.
Right.
Cool.
So you'll notice that the downward angle isn't like she's hanging upside down, but it does give an angle so that as we do PT, it can help free up the mucus a little more. So we are going to move to her lower lobes, and we're gonna start here on her right side.
That's my left side.
Left side.
Do you want to show them kind of the difference in the upper lobes versus the lower lobes?
Yeah, so basically the way I do it, this is totally a non-medical, unscientific way of knowing upper lobes and lower lobes, but I start right at her, what do you call this thing?
Armpit.
Armpit, and put my right hand there, and then my left hand right next to it, and I do those for the upper lobes. And then what I do is I move down, basically those 2 hands, and I move down 2 hands to do her lower lobes. Now, as Mary said, her liver and kidneys are sometimes sore, so I just have to be careful how low I go. And then once you're done that set, you do your vibes. Next, Mary's gonna flip on her back. We're gonna do the front lower lobes. This is probably one of the more difficult positions for me as I'm trying to get my hands in the right angle. Sometimes depending on whether we're doing it on the bed or on the couch or on the floor, sometimes I'll do this hand over and this hand like under, I don't know, what do you call that? Sometimes you can sit on a chair and get in the right position. Sometimes if like it's easier, I'll do one side at a time and then I'll do this side. Like if my wrist was broken or something. Just kidding. After that position, do your vibes there.
I think when you're switching positions on your couch cushion, you might need to scoot your hips up a little bit to get the right angle.
Because it's kind of like a slide.
Because I'm kind of sliding down right now.
Yeah.
So are my pants.
Okay. So she's gonna flip over. I'm gonna do the lower right side. Once you're done that position, do your vibes. Okay, then the last position, she's going to roll onto her stomach, if she can.
Oh. So basically you need to be a gymnast for this activity.
All
okay.
Right.
I think I'm gonna take that away.
Alright. And she's gonna take her glasses off for this one. So as we do the lower lobes on her back, we often find that this position is really effective for, it's kind of the final position. It helps it's direct on her lungs, clearing free some of that mucus.
So if you feel like you need more time on any of these positions, you can do it. Sometimes we'll do a few more minutes on this position since I find that it's very effective.
Yep. And then the vibes.
And then you look like you've been through a tornado.
As you can see, I have a lot of respect for Mary and all the work that she goes through. We kind of take this as a team and try to make PT as fun as it can be. Some days it's quite dreadful, and we push through it. And so we hope this is helpful for you, that maybe you can find some new tips or positions or whatever techniques that might be helpful for you in clearing your lungs or helping your family member or friend clear their lungs.
And as the Cystic Fibrosis Foundation has named November the CF Caretaker Month, I want to say a huge thank you to my parents who grew up, or when I was growing up, they did chest PT on my sister and I. And now that I'm married, thank you to my husband for being so willing and being always available for when I need chest PT. So I just want to say a huge thank you to all caretakers out there, and whether you are a family member or you're in the medical profession, we appreciate you and we appreciate the work that you do, and the work that you do is life-saving.
And it makes a difference. And so thank you, and if you know someone with CF, maybe sometime say, hey, you want to hang out and I'll try to do chest PT?
And then videotape yourselves and send it to us so we can enjoy it too. You guys, hang in there and keep taking the best care of your lungs that you possibly can. We cannot possibly be perfect, but we can do our very best to take care of our lungs and do what we need to for our bodies. So hang in there, and we are cheering for you.
Mary and I make videos every day, kind of just showing everyday life. You'll see us doing PT and just living our lives. If you want to check us out, you can subscribe to our channel, The Fry Life.
And if there are any other specific CF therapy medical videos that you'd be interested in seeing, if you could leave a comment down below and let us know what other videos you'd be interested in, we could take a look into if we could do it for you.
There you go. All right, guys, we'll see you next time.
Bye!